Welcome to the second video in our how-to series. This video will show how to prep a zirconia crown for number 19. Here are the steps that we'll go over in this video. First, starting off with the eggshells, next the buccal and lingual depth cuts, occlusal depth cuts, connecting it all together, beveling, and then finishing it off with refinement and final checks. Step 1. Create our eggshells. This is to break interproximal contact. When breaking your interproximal contacts, try to be as conservative as possible. Do this by making your eggshells as thin as you can. As you can see in this clip, you're going to line up your burr and just cut straight through. This is how thin your eggshell should be. Now moving on to the distal side, we do the exact same thing. Make it conservative, line up your burr, and cut straight through. Always make sure you see where you're going so you don't nick the adjacent tooth. This is how your prep should look like after completing step 1. As you can see, the eggshells broke off and the adjacent teeth are intact. Again, try to keep this conservative. On to step 2 for our crown preparation, the buccal and lingual depth cuts. When creating these depth cuts, the most important thing is to have your burr angle parallel to the long axis of the tooth. This is something that you have to envision, and it takes practice. When making these depth cuts, try to keep your burr parallel to the long axis of the tooth. You can use your adjacent teeth as reference points too. Establishing the long axis of the tooth is important before you make your depth cuts. As you can see, the operator is making sure to keep her burr at the correct angle before making her cuts. It is always a good idea to consistently check your prep and adjust anything along the way. Step 3. Occlusal depth cuts. This is where you can position your depth cuts. Position it on the triangular ridges of the tooth and the grooves. Whatever burr you are using, make sure to understand the dimensions of it to see how deep you need to sink your burr. You want to position your depth cuts in the location like I mentioned earlier. It is important to follow the correct angulation of the triangular ridges because if you don't, your reduction would not be uniform. Step 4. Connecting all the depth cuts. Once again, make sure you're angled to the long axis of the tooth. You want to get rid of all the excess tooth structure in between your depth cuts. Once you get your burr angle locked in, the most important thing is to watch your margin. Make sure it is the proper height, which is 0.5 millimeters above the gum line. When you are rounding interproximally, make sure your burr is angled properly in both the buccal lingual dimension and mesial distal dimension. A common mistake is to over-taper or undercut the corners of your crown prep, so make sure you have the proper burr angle to prevent this. Once again, always check your prep in the mirror. The tricky part about this preparation is rounding off that distal lingual corner. To combat this, you can use a mirror to see where you're going, or you can establish your proper burr angle in the buccolingual and mesial distal dimensions, not use a mirror, and just hope for the best. Just kidding. Make sure you're cautious and envision where you're going. When connecting your occlusal depth cuts, make sure your burr is angled parallel to the triangular ridges. Make sure you're reducing your central groove as well, and do not extend your burr past the central groove, as this would cause migration. Step 5. Your bevels. When creating your bevels, you can use your putty as a guide, or you can also compare it to the adjacent tooth. These bevels will align your cusp and ensure adequate reduction in these areas of your crown prep. As you can see, you can compare your burr angle to the occlusal third of the adjacent tooth to get the proper angulation. Reduce until your cusp tips on your preparation line up with the cusp tips on the adjacent teeth. Next, the lingual non-functional bevel. Make sure to reduce until your cusp tips on your crown prep are aligned to the adjacent teeth, which ensures adequate reduction. The final step, refinement and final checks. Refinement includes removing sharp edges and making sure your crown prep margins and walls are all smooth. The first check is to check for undercuts and overall taper of your prep. Theoretically, you should be able to look directly down on your crown prep and see the entire wall to the margin. To make it easier, close one eye and use an explorer to check around your prep. Follow the tip of the explorer around your prep and make sure it does not disappear. If it does, you have an undercut and you need to fix it. The next thing you could check is the height of the margin. The margin should be half of the RGS3. Alternatively, you can use a perio probe or the RGS1, which is 0.4 millimeters in diameter. The margin should be slightly above this. This picture shows the alignment of the cusp tips and the central groove. If you have adequate bevel reduction, your cusp tips should be aligned. Proper occlusal reduction would keep your central groove centered. So this part is how to evaluate your prep with your putty. So the first thing you should know is the dimensions of your preptures. Note that you can also use your condensers, just know the dimensions of it. The yellow prepture has a 1 millimeter diameter, red has 1.5, and blue has 2 millimeters. The proper occlusal reduction of this crown prep is greater than 1 millimeters and less than 1.5 millimeters. The proper axial reduction is 0.5 to 1.5 millimeters. This means that as you're checking your reduction in the putty, there should be adequate space when using the 1 millimeter yellow prepture. The 1.5 millimeter prepture should fit very snugly and could potentially be bigger than the clearance with the putty, so that could lead to dislodging it. The 2 millimeter prepture should not fit. If it does, that means you over-reduce your prep. As you can see, the 1 millimeter prepture fits very easily, meaning the reduction is greater than 1 millimeters. But the 1.5 millimeter prepture dislodges the putty, but that's good since you are within the perfect range for reduction.